Well, I'm sitting here with Dr. Sid Baker, who is certainly one of the pioneers of functional medicine and has a career that has spanned, 50 years, certainly long before we were calling functional medicine functional medicine. And Sid, I haven't seen you since the annual conference where you gave a wonderful presentation in 2018. And ask you a few things and have a conversation with you. Your career started with, as I've heard you talk about, and with your mentor, Edgar Miller in Kathmandu, Nepal, and you went to Yale Medical School and I believe back to Africa and Chad, and then on to the Cassell Institute, where you met another, functional medicine pioneer, Leo Gallen. And with that beginning, what really have been the biggest challenges for you on this path? What can you tell us about that early arc of your career?
Well, I must say, I didn't really suffer much from challenges doing this. When I came back from being in Africa for 2 years between my second and third year residency, I came back to be chief resident. And some of the assistant residents were kind of had a funny attitude about all this stuff I'd learned from being in Africa. But I was able to let that roll off me pretty well because I'd been pretty well prepped to go straight onto the faculty at Yale Medical School. And I really didn't have too much mischief from my contemporaries. When I especially went in again into practice and was on the sort of informal faculty, then I took a little bit of flack because I was beginning to listen to my patients, which of course was not considered a Yale thing to do. So I had already strayed into listening to patients and then trying some of the things they taught me, which were remarkable and effective and so on. But other than that, I had a happy life.
That's good. So your experience, I know, in Kathmandu, as you've told me, and also I think in Chad, and your experience with the microbiome and parasitology and how these particular protozoa had such a significant effect on health in those regions, and then you came back to the United States, and you realized that the microbiome and these little critters, as you have fondly called them, really had a pivotal place in health and disease. And I know you went to a conference in Alabama in 1984 with Orrin Truss and Leo Gallen, and that was from actually talking with Leo a little bit, seemed like a pivotal moment for functional medicine and for thinking about the microbiome in a more concentrated way. Was that a moment that shaped your path as well?
Well, yes, because it brought together people, a common openness to new ways of thinking. But of course, I brought to that what Edgar Miller had said to me, which is, have we done everything we can for this patient? And when I came back to Yale, it was, have we done everything we can for this disease? So I had already at that point begun to form the foundation for the sentence that I think was part of the origins of functional medicine, which is, could this person have a special unmet need to avoid, or get rid of something which, if taken care of, would favor nature's buoyant impulse toward healing. I think that when I had become friends with Jeff Bland, it was clear that he was just had an overwhelming access to the medical literature, but he did not have a box to put it in. And with that sentence, I think I provided a box for people to think a different way about healing, which is something that nature does and that we have to provide to patients with chronic illness, a detective work that has to do with avoiding or getting rid of things. It's very simple, but I think that that's a contribution that I made to the beginnings of functional medicine.
Yeah, I think that's well put, Sid. That the other thing I remember reading about something you said is just that constant refrain that is in your head about what your mentor said to you. Have you done everything? And in these complex chronic health issues, it's understanding when you have done everything, how long you should stick on a particular kind of path. Is this a viral, parasitic, bacterial? You know, what can you tell me a bit about how you're able to determine if you're on the right path when you see these very complex patients that maybe they're children or adults?
Well, I think there's a good example of what you're referring to is the very rapid response that people will have if you do changes that are aimed at their circadian rhythm, that is the morning, the daytime versus the nighttime. Many people are not in sync with that. And so if you take just a quick list of things to do, that is get protein in the morning and carbs in the evening, stay dark at night, turn the lights off and don't get exposed to light when you're in the middle of the night. Get magnesium, which is the shepherd of light in an important way. Tryptophan, melatonin, herbs such as chamomile, milk thistle, kava kava, valerian, so on. And pantothenic acid and exercise, just those 7 different things. If you do those and you don't get a result from it, you should know within a few days that you're on the right track for any or all of those steps. So I think that it's amazing how quickly the human body will respond by having what we call healing, even though there's a certain complexity to all the different things you might need to do. But the list that I just gave sort of brings everything together and acknowledges that the nighttime is a very different time than daytime in the human body. And if you don't pay attention to that, you're sacrificing a big part of the kind of interventions that we want to make to, as we say, to favor nature's buoyant impulse toward healing.
I like that phrase, favor nature's buoyant impulse towards healing. And you wrote, I think, well, I know you wrote a book now over 20 years ago on the circadian prescription. I think that was the title of the book. And it's, at some level, I find it kind of prescient, the kinds of things that you've put together in the 80s and 90s and 2000s that are now, certainly there was research to support what you were saying then, but now that research has just become so much more evident and widespread that this chronobiology, as you're referring, is such a significant part of health and healing. and so uh, I think that again you've kind of set the stage in many decades of where this integrative systems-based approach should be looking. And you also wrote a book, I think, after that circadian prescription, but in the early 2000s on detoxification and healing. And can you tell me a little bit about why you found that and still find it so important as a part of the health journey? Whereas I think that conventional medicine still doesn't look at that as an important part of health and healing.
Well, to me, it's obvious that part of the body's job is dealing with toxins that are, of course, what we produce ourselves, which we have pooping and peeing as a way of dealing with it. And sometimes it behooves us to consider what burden this places on the body and what things we can do to ease that burden. And that has, of course, a lot to do with food and things that are helpful in doing the body's work that have to do with the liver, the function of the liver and the digestive tract. So so that's where the detoxification comes into the title of a book that's about healing, and it's relatively simple and has to do in large measure to timing. And the list that I just read about protein in the morning and carbs in the evening and dark at night and so on, and magnesium. These are things that, if employed, will have a rather rapid effect. And then the good news is that you don't have to do it for a month to find out that it ain't working. Obviously, there are certain things that need to be approached in a different way, but the body has this remarkable impulse toward healing that can be advanced by dealing with things like timing and putting in good things and letting bad things get out.
I recall many metaphors and analogies that you use. I'm sure you have many that you've used over the years. The one that I particularly like to recite, both to professional audiences, but also to patients, is the TAC rule that I took from you. Could you talk about where that came from, or was that a particular that you had a particular insight, or it just kind of came up out of your unconscious one day?
Just came out of the crisis that occurs when you stand in front of a room full of 100 or 200 people and have to think of something that will provide a metaphor that is memorable. But the idea, and also it's relatively well illustrated in a particular slide that I have, sitting on two tacks or sitting on one. I just used it last night when I was lecturing to people in Indonesia on Zoom, and it gets the message across that if you're sitting on two tacks, removing one doesn't produce a 50% improvement, for example.
Is there any other analogy, metaphor that you use constantly and you found that you've used for the past 30 years? I want to make sure I'm not missing any that I should be saying to my patients.
Well, that's demanding on my memory, which is not one of my major virtues at the moment. Nothing comes popping into my mind. I think that what I learned from Yehuda Schoenfeld, I think it comes close to that. And what Yehuda says in the first sentence of one of his many, many books is that while some would say that everything is autoimmune until proven otherwise, in terms of chronic illness. But then he says, reading the chapters in this book written by world leaders in autoimmunity brings one to the conclusion that everything, after all, is infectious, including autoimmune problems. In other words, germs have this dynamic relationship with us in which the immune system is challenged by the presence or absence of certain kind of microorganisms that are part of our makeup. And I think that it's helpful for our colleagues and for patients to understand that there are certain themes that really run deeply through all of medicine. And in my experience with HTCs, the premobiotics that I grow in the laboratory right over there, these are, tiny helminths, worms, that I really was open to because I spent 2 years in Africa, before I came back to be chief resident. And it was quite apparent that the kinds of illnesses that people have that I took care of in Africa are a completely different book full of things that can be wrong with people. And they did not have all the things that we have, which is cardiovascular disease and all kinds of autoimmune problems. It was a striking comparison that I faced when I took my inventory of knowledge about diseases, so to speak, and tried to apply it to my African patients who simply did not have all of the chronic inflammatory diseases. Now, obviously, they had a lot of things wrong with them, different kinds of parasites, but the lack of parasites in our bodies we've paid a huge price for that. And so the restoration of immune tolerance, that's what I think I'm doing, and I am doing with patients, is the restoration of immune tolerance, which then applies to the healing from all kinds of different things, from autism to alopecia, is a wonderful tool and very simple. But I was opened up to it by living in a different culture where they simply didn't have lots of illnesses. And we have those illnesses because we don't have a certain part of our microbiome that has to do with worms. But we're talking about little tiny things that are just a little beyond microscopic. And the restoration of health when people take those things is stunning. It's really wonderful. So my little laboratory, which produces these things, and we send them all over the country, is really a thrilling thing to be involved in.
Yes, it was that conference that I alluded to in 2018, where you gave a wonderful presentation, and Dr. Schoenfeld gave a wonderful presentation around that topic, and Dr. Parker, and I think that from there, not from there, but since then there have been additional research to kind of again support this path that you are in part blazing. And I think the term restoration of immune tolerance, restoration of health, I think they are synonymous. So I think that's a wonderful insight that you've given there. I want to kind of end, Sid, and ask you, where do you see in the next 5 to 10 years, where do you see this systems biology, functional medicine moving forward in the future? What is your, if you had a crystal ball, which I sometimes think you do, what is your a sense of how this field moves forward?
Well, I think it's headed for hard times. Until now, I think the conventional medical world, who see their job as treating diseases rather with pills, rather than restoring health by achieving balance in the individual, they're going to get nervous, I think, about the efficiency of what we're doing. Just turn on the television, you see these advertisements for these very yucky medicines with all kinds of horrible side effects. And you see that the pharmaceutical industry and sort of mainstream medicine has bought into this in a very big way. And when there's that much money behind that kind of a collective attitude, it gets pretty scary for those of us who have a different way of viewing the world. We do see such wonderful changes in people when they're treated the way we do them, that on the one hand, that's good because it's good advertising, so to speak. But on the other hand, it makes the mainstream people very keen to come down on it in different ways and ask people to not believe what we're talking about.
Yeah. Yeah, well, I think your caution and, as you say, difficulties that lie ahead, and also the promise, the potential promise that lies ahead in the kinds of things that you have championed is a good way to end. And I want to thank you, Sid, for really for being such an important leader in medicine and in functional medicine. And I think your ability to humanize the practice of medicine has been an inspiring example for me in particular, and I think for many of the clinicians that you have taught over the years. So I want to thank you very much for taking the time to sit and chat.
Thank you for saying so. And let me just finish with one suggestion, which is that we publish. And Bill Shaw and I just published a paper about a child that we treated who had aspergillus in his body, and by giving him an antifungal medicine for a number of weeks at a very high dose, which he tolerated beautifully, this very autistic boy became an absolutely perfect little genius. And he's off medicine now, and he's just in great shape as a child. With, as I say, when he came out of his illness, he was very advanced intellectually in every other way, and now he's all better. He's not taking any medicines, and and so we published it because people have to know that this can happen, and has to go into a journal that is respected in terms of getting the recognition that things deserve in the medical world.
Well, I'm glad you're continuing to publish and to work. Are you continuing to see patients then virtually?
No, I'm not.
Good.
I'm too old for that.
Well, I appreciate that. I appreciate that. I appreciate your time, Sid, and also that you are continuing to work, and it sounds like continuing to lecture to an audience, and continuing to publish and think deeply about this. So that's wonderful to hear.
Well, I'm lucky. I'm having a good life.
You certainly are. I appreciate you.